family planning as a focus for discussion has demonstrated or has improved considerably. However, we are not happy with our contraceptive prevalence rate. Regrettably, the last NDHS indicate that modern contraceptive use rate is just 12%.
We are in a demographic crisis. Our population is largely youthful. 70% of our population is under the age of 30. And then if you look at all the attendant problems that come with it, security concerns, poverty, inefficient use of resources, can we come out of it? Yes, we can. And the key is family planning.
Evidence has shown that maternal mortality is reduced up to about 30% using family planning.
Government is highly committed to ensure that the family planning is an integral part of the package of reproductive health services in Nigeria. But you know, this cannot be done alone by government.
We are Nigerians, and as Nigerians, we need to continue doing the best we can, for our people. And that is what NURHI has done.
Over the years before NURHI came onto the landscape in Nigeria, the family planning terrain was a bit stagnant, especially with the use of modern contraceptives. The contraceptive prevalence rate was static, and despite all interventions, there seems to be no shift. And so everyone, stakeholders, were at a crossroad as to how to ensure that the momentum for modern contraceptive use in Nigeria should get activated.
There was a lot of myths and misconceptions, misinformation, suspicion about family planning. One of the things people felt was, believed that it was family planning is a Western agenda, aimed at reducing Nigeria's population, which was wrong.
NURHI saw that for the family planning landscape in Nigeria to change, it needed to use a demand-led approach. And that demand-led approach significantly must also embrace the consumer lens, which means understanding the consumers, the population needs of every family community, and using that to co-design and frame how to intervene. So in phase 1, we started with 6 urban cities that was spread from Ibadan, Kaduna, Ilorin, Benin City to Zaria.
The NURHI approach was a 3-pronged approach: advocacy, demand generation, and service delivery approaches to address the family planning needs and increase family planning uptake in Nigeria. So one of the, successes of the project was to ensure synergy between the 3 thematic areas, making sure that there was collaboration and partnership in all that they did as they keyed into a common goal.
The project was designed to improve the environment for family planning, and that was the role of advocacy. Leaders, religious leaders, traditional leaders, opinion leaders would make public statements identifying with family planning. People will be very much comfortable discussing family planning, largely. The media would also be discussing family planning.
NURHI has done very well. A good example is being able to get to gatekeepers in communities and remove the barriers, at least in some of the states that they are working, which is now at least, a very good plank that we can use to make sure services go around the country, removing the barriers. Most importantly is the work they have done with the religious interfaith group and producing the Christian and Muslim perspectives of family planning.
The basis for demand was established, already known, because based on the NDHS of 2008, which was what we used, the data we used, we found out that over about 83%, an average of 83% of Nigerians were already aware of family planning. But the CPR was as low as 10%. And the unmet need was as high as 20%. So we already had what we call the hanging fruits. They were very close. So we needed to work towards achieving the goal by targeting those that are already willing to use, and also by targeting, building on the awareness.
The partnership between CCS, the Center for Communication and Social Impact, and the Nigerian Urban Reproductive Health Initiative project has offered the platform for us to bring our local expertise on social and behavior change communication, to be able to deploy intensive community mobilization in the different states where the project states where NURHI rolled out its interventions, and also to create approaches, innovate approaches that are actually suited to the local context based on evidence, and also use these approaches to actually get the audience to take up some of the behaviors that we were talking about with respect to family planning methods and family planning approaches and family planning methodologies.
When you look at virtually all the states where NURHI has been implemented, there are journalists we've trained, there are journalists who have come together to form forums, there are journalists who have the expertise, there are journalists who go out of their way to look at the beneficial effect of family planning, not only on women, but on the family, on the man, on the children.
Quality of care is critical to health-seeking behavior and to uptake of services. In interacting with clients or community members, we realized that many of them did not even know where their health facilities were located within their communities. And then those who knew where the health facility was located would give a feedback that those health facilities were not functioning. So it was obvious that they had lost trust in the system, in the health facility, for several reasons. So the 72-hour makeover helped us to address those issues. We closed the facility on Friday, and by Monday, when community members come to the facility, there's an entire new facelift. The whole structure is redone, from painting to changing damaged equipment and furniture, to also replacing medical equipment that needed to be replaced. And prior to all of this, we trained the service providers in communication skills and counseling, as well as in competency training.
One of the major differences between NURHI and most projects is the fact that NURHI invested in the use of evidence. Now, to implement a good program, you need data at the formative stage. It is very important to let data guide how program is designed, how program is implemented, and of course, for mid-course corrections.
Even though we made an impact in the first 5 years, because we succeeded in increasing family planning use in the 6 cities by an average of 11.9 MCPR, which was amazing. And this was also confirmed even by the 2013 NDHS. The funder, BMGA Foundation, felt that we needed to sustain these results, these achievements, so that in sustaining, we are scaling up more to new geography.
At the end of phase 1, we were able to come up with a theory of change for Nigeria, which we call the ideation theory, for promoting and improving the use of modern contraceptives in Nigeria. And we used this model that was designed with evidence and scaled up in phase 2 to other geographies.
The relationship of ARF and NURHI is one of the best I've ever experienced in the 40 years that I've been involved with reproductive health program in Nigeria. And the reason is very simple. Ab initio, it is equal partnership It is partnership with governments at the federal and state level. It's partnership with CBOs that you're working with. And I think that has resulted in the success stories that NURHI has had over the years.
We have been able to work together in the area of creating an enabling environment, NURHI supporting government to put together necessary guidelines, roadmap, training manuals in different modules with a lot of innovations.
NURHI has supported the Federal Minister of Health to develop the capacity of officers in health promotion, in strategic leadership and communication. Likewise, NURHI has trained about 30 officers from different departments within the Federal Ministry of Health on smart advocacy.
The Challenge Initiative, which is a global initiative that Nigeria is also privileged to be part of as the Nigerian hub, and also led by us, the John Hopkins Center for Communication Programs, will be the sustainable platform for us also to continue to make the expertise needed for adoption or adaptation of this proven to work homegrown model that NURHI designed in Nigeria. TCI is currently in 10 states and will be expanding to about 2-3 more.
The Challenge Initiative was birthed out of the success of the first phase of NURHI. And our implementation model is actually to scale up the NURHI high impact interventions that has worked, but taking it to scale. It's really been good to have a flagship and game-changing project as NURHI to have challenged the family planning ecosystem, after many years of trying various models without having as much traction as they have actually had. And we at TCI are really privileged to be a critical part of that core, and indeed we share in the same DNA as NURHI.
It's one project that was driven by Nigerians, led by Nigerians, implemented by Nigerians.
Everyone that was employed during that period, they took it as a passion to make sure that they deliver, and 2, they are accountable, and 3, they ensure the success of the projects as relates to their own techniques. So each person is working towards their success. So eventually, when you aggregate the success of every individual, it is summed up to the success of a project.
The Get It Together campaign became a household word. The ordinary woman in the streets became an advocate, a champion of family planning. The religious leader became a champion of family planning. The community leaders were in the forefront of family planning, for family planning, and they gained the voice to demand for improved services and funding from the policymakers at the local level. The legacy of NURHI for me is not just a 10-year legacy, it is a lifetime legacy.
I like to see a Nigeria where family planning becomes a social norm, which means it becomes an integral part of our life. Just like Nigeria being a very entrepreneurial society, to see it as a fiber for development.
I would like to see in Nigeria where family planning services to women make it possible for a woman to have services wherever she is in Nigeria. Hard to reach, easy to reach, but the service must be qualitative, must be right-based, and must be the woman's choice.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the Basic Health Care Fund and universal health coverage. And healthy women can better take care of their children. Healthy women give healthy children, and the government itself is interested in a healthy workforce and a healthy population.
So most importantly, I want to appreciate our donors, the Bill and Melinda Gates Foundation that gave us the platform to be able to dream, design, and innovate, and test out and design a proof of concept that worked for Nigeria. Of course, the government of Nigeria for even inviting this platform, seeking out resource to help out in shifting the stagnant landscape of the family planning terrain in Nigeria. Of course, as we did the proof of concept, we also had private philanthropists who co-partnered with the Bill and Melinda Gates Foundation, that is TJ Martha, who co-partnered with us as a co-pilot to support us with resources to scale up in phase 2 as we were scaling up to new geographies in our journey of ensuring that family planning become a social norm. And of course, all the CSOs that are too numerous to mention. Also our core partners that are co-journeyed with us in these 10 years, the Association for Reproductive and Family Health, AF, the Center for Communication and Social Impact, CCSI. We've handed over the baton, and so keep the flag flying, keep the fire burning, and it should burn higher and greater and brighter until that point where we can say surely Nigeria has really evolved to have family planning as a social norm.
Nigeria
should get it together
for a brighter future.